P.A.I.R, Parent and Infant Relationship Clinic, Vanier Children's Services.
The P.A.I.R Clinic was an initiative that came out of our knowledge of infant mental health and really understanding that babies' brains develop primarily based on what happens to them in those first few years of life. That the most impactful relationships in a child's life are their relationships with their caregivers in those early years. In 2018, early in the year, we started really looking at our referral base and noticing that 3- and 4-year-olds were coming into Vanier with some pretty significant behavioral concerns, emotional concerns. As we were starting to offer support, a lot of the parents were saying, I wish I would have known this earlier. I wish I would have had this service when my baby was 6 months old or 4 months old. And so we decided to try to create a program, and we wanted to really address the level of stress that families are under in those early stages and really be able to offer families services around mental health for themselves and their infants without having to come to a mental health center, without having to have a clinical issue, and helping work through all the intrusions and disruptions in parenting that prevent parents from really feeling confident in their relationship with their babies. The way the P.A.I.R Clinic works is that we go into family centers where families are already attending with their babies and children. So if they have a question about how their baby's emotions are developing or how they're responding to their infant or what's happening in their family, they can ask those questions informally, on the fly, right on the floor of the play groups. We also have individual therapy offered. So if a family wants a session just to talk about what's individually affecting them and their baby, they can have that with no fee, with no long-term wait list, with no intake. They can just come in, give us their name, and talk about whatever it is that's impacting their family at the time. We also were able to provide interpreters for people who speak different languages and really connect with people in those newcomer communities. Just having conversations about the stress, the strain, the exhaustion can be so helpful in helping a parent feel understood. As we've collected stats through the P.A.I.R Clinic, we have realized the numbers of families we saw were in the hundreds. The feedback we were getting included parents saying that this was life-changing, that they had a new way of viewing their infant, that they were able to obtain services for themselves in other areas of the community. This was really thrilling to be recognized for the P.A.I.R Award. This has been a labor of love for all of the partners involved, and this gives us a chance to really explain how what happens for babies in those early years and what happens for families in those early years can really predict the health and well-being of those families in the future.